In this module, we'll be learning about some theories that help explain early childhood education. There are many theories we could discuss. This presentation will just introduce you to a few of them. If you don't have a background with early childhood, or if you haven't studied early childhood theory before, you may be thinking that learning about theories sounds a little bit intimidating, but I promise I will give some specific examples to help make sense of them. Jean Piaget is one early childhood theorist who came up with the theory of cognitive development. Piaget's theory has 4 stages listed here, the first of which is the sensory motor stage, which happens between newborn stage and 2 years old. So there's a lot of changes that happen in that first stage. It actually does have sub-stages because newborns are so very different than toddlers, as some of you know firsthand. But some of the main things that happen in a stage are that babies and young toddlers learn by exploring. So they learn by touching and by looking at their mother and by feeling things and putting them in their mouth, by hearing sounds in their environment. One thing that happens in the sensory motor stage is that babies begin to learn about object permanence. So they learn that even though an object may be hidden, it's still there. I remember this from when my kids were infants because they would want to play with my husband's glasses. So he would take them off and hide them under the blanket nearby or in his pocket or something. And there was a time when he could get away with that, and once they were out of sight, they were out of mind. And then all of a sudden, they began to realize that no, the glasses weren't gone, they were still there, even though they were hidden. The next stage is the pre-operational stage. This includes preschool and early primary grade children, as well as those older toddlers. So again, this is a wide range of ages and abilities. But some of the things that happen here are that children really can't think logically much. They have a lot of mistakes when they try to apply logic, much like a toddler learning how to walk for the first time who takes a lot of missteps and falls down a lot. They have a lot of problems thinking logically. So one of the things here that we need to think about is that children often get confused about cause and effect. So the infant in the sensory motor stage was pushing off crackers off the high chair to see what would happen as the mother repeatedly picked them up and put them back, or pushing the spoon off because it makes a louder noise when it falls on the ground. So in the pre-operational stage, if something occurs right after something else, the child may think that that was a causal relationship when in fact it wasn't. This can happen when parents or caregivers try to implement consequences and they give a punishment or a consequence for something that happened hours ago or days ago, and the child doesn't make that connection. The concrete operational and formal operational stages, I have those up here so that you can see the names of the stages, but really those occur in later childhood and adulthood, so we won't necessarily need to focus on those right now. The next theorist I wanted to discuss with you is Lev Vygotsky. I really find this theory very helpful, and it's the sociocultural theory, and he talks a lot about the zone of proximal development. So to some extent, this theory is common sense, that we want to challenge children to do things that are a bit difficult for them, but still within their ability to be successful. So if you look here at this chart that I created, the bottom is what the child can do independently. This is without any help. I often use the example of a child completing a puzzle, but this could be used for any skill or concept that the child is learning. So let's say, for example, we have a preschool child who can do an 8 to 10 piece puzzle independently in that bottom section. So then the zone of proximal development would be challenging that child to do a slightly more difficult puzzle with assistance or with some help. So then I would give them maybe a 12 or 15 piece puzzle, and then I would give them scaffolding, which means that as a more competent peer or the adult, I could say, okay, let's look for the edge pieces. First, let's start with the blue sky. Do you see a piece that has a straight edge that's also blue for the sky? Okay, so I could give some verbal hints and clues, and that is when the child is in the zone of proximal development. Above the zone of proximal development is what the child cannot do yet, even with assistance. So here we're talking about a preschool kindergarten child. They cannot possibly complete a 500-piece puzzle yet. That is outside of their skill set. They cannot do that, even with assistance. That's outside of their abilities at the time. Now, the cool thing about the zone of proximal development is that it moves as the child learns. So once the child does that 12 to 15 piece puzzle with assistance several times, all of a sudden they can do that independently. So that skill moves down to the bottom box, what they can do independently. And now the zone of proximal development is even a more difficult puzzle, maybe even a 20 to 30 piece puzzle. And then what they cannot do is still those more challenging puzzles. So hopefully that makes sense to you. This is something, again, that it is a theory, but it can be implemented in our day-to-day practice with young children. The next theory here is Erik Erikson's stages of development. Here we're talking about social emotional development. So the first stage, that most important foundational stage, is trust versus mistrust. Now this is when the infant needs to learn that he or she can trust their caregivers to meet their needs. This can be, of course, their physical needs, like that they'll be fed when they're hungry, changed when they're wet, but also that they'll be kept safe, that they'll be held. All of those things are part of trusting their primary caregivers. Now, a little bit of mistrust is normal, and we want children to develop a little bit of mistrust of people or situations that they're not familiar with, but we want them basically, again, to trust those primary caregivers to meet their needs. Building on that, the next stage is autonomy versus shame and doubt, and here is when the toddler is still very dependent on the caregiver, but they want to try doing some things independently. Maybe the child is choosing what they want to wear from 2 choices that day. Maybe they are starting to get dressed. They could be working on toilet training in this stage and using the toilet independently, and then of course pulling up their pants, flushing the toilet, washing their hands, all of those things that go into that. And then after autonomy versus shame and doubt, and these stages kind of all do build on each other, so there are some similarities, but the next one would be initiative versus guilt, which is where the preschooler is wanting to take initiative. Now, if they are made to feel guilty or shame, then that's going to undermine their wanting to be independent and take that initiative. So in the photograph here, you can see the boy trying to pour milk. So if he spills that milk and the adult makes a big fuss about it and reprimands the child, then again, they may not want to try doing that task again independently. So then you can see the rest of those stages there, industry versus inferiority, kind of building on that initiative versus guilt, again with slightly older children doing more difficult tasks. And then with children who are going through that adolescent stage, we have identity versus role confusion. And then the last 2 happen with adults and later adults. So again, those are not stages we really need to focus on for an early childhood course, but I have them there so you can see the names of those stages. Skinner is one behaviorist. There are other theorists, of course, that are behaviorists. And behaviorism, we talk about using rewards and punishments, trying to shape the child's behavior. So being a good role model is important. So this theory, it does have its limitations. Know, it can be useful as well. So an example of when a child is toilet training, I know when my sister, not my sister, excuse me, when my daughter was in childcare and other little girls were using the toilet independently and they started earning princess stickers, she was very motivated to also use the bathroom and earn princess stickers on a potty chart. And so that is what really piqued her interest and kind of got her motivated to try using the toilet independently. So with rewards, we want to be careful because they can lower a child's intrinsic motivation to do something on their own because we're giving them that external motivation to do it instead. So of course, with toilet training, we know that child isn't going to always need that reward to use the toilet. We might use them for a time and then sort of back off and do them less and less frequently until we gradually get rid of that external reward altogether. Now, external rewards could be praise and encouragement as well and that other physical or tangible rewards too. Howard Gardner has a theory of multiple intelligences, and this theory is great because we know that every child is smart in their own way. So the first two intelligences are the ones that are focused on most in the schools: logical, mathematical, and linguistic intelligences. So we know that we want kids to know their basic math facts and also have a strong foundation in reading and writing, but the others are important as well. And if a child isn't strong in reading and writing or math, maybe they are naturalistic intelligent and they know all the names of plants and animals that they see in their yard. Or maybe they are musical inclined and they like to sing or dance and play musical instruments. We also have the bodily kinesthetic intelligence, which means that the child is good at using their body. So this is potentially the future athlete who is very good at a particular sport, but also these children can learn other concepts by moving. So we can incorporate that in lessons in the classroom as well. We also have the visual spatial intelligence, which is the person who is very good at puzzles and really using that spatial awareness. So think of, an interior decorator here has to be very intelligent in the visual spatial way. And we also have intrapersonal and interpersonal intelligence. So intrapersonal meaning that the person is very smart about themselves. So maybe they prefer to work independently and they really understand their own strengths and areas for growth. They know how they learn best and those types of things. And then being smart as far as intrapersonal intelligence means that the person likes to work in groups and is good at communicating with other people and understanding others. So those are the intelligences. And again, we can incorporate these in a classroom setting. Especially with young children, they tend to all like music and all need to move. So the more of these intelligences you can include in, maybe a theme that you're studying or a certain topic, then the better the children will be able to learn those concepts and skills. We can also use these intelligences as we're assessing what children know. So maybe they can write a book report, but alternatively, maybe they can act out a scene from the book or sing a song about the book that they've just read. So a really good theory to keep in mind. I find it very useful in my own work with young children. So those are the theories that will be covered in this presentation and also in the textbook. Hopefully you will come to learn about some of the other theorists that have been influential in the field of child development. And we're going to be coming back to these theories throughout this course as well. So don't have the mindset that if you get through this module that you're done with these theories, but really let's try to think how we can apply the information in later modules to what you've learned about some of these early childhood theorists.